Aloha, welcome everyone. Thank you so much for joining me today. My name is Dr. Kathryn Taketa-Wong. I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we have to attend a 4-year medical school. We're trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. However, a big difference is that naturopathic doctors are trained in the power of nutrition to help build health from the inside. And I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and to treat the whole person. I also have a master's degree in Oriental medicine, which allows me to include acupuncture and Chinese medicine in my treatment protocols. So before we begin, I wanted to let you know that if you have health concerns that you would like to talk with me about, we offer a no-charge phone consultation called a Personal Health Strategy Session. This is a 15-minute strategy session where we can talk about your condition and come up with a plan to see how I can help you the most. Arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. So, and I did want to mention too that today we are going to be talking about special diets for autism and ADHD, and we'll be discussing some of the symptoms that can be helped potentially by each of those specific diets. I do want to emphasize that this is really meant to be an introduction and a brief overview. We could honestly spend hours. I mean, this lecture could literally be like 1 or 4 hours if we really wanted to get deep into the details of all the different types of diets that can be helpful for autism and ADHD. And our session is probably going to be, maybe 30, maybe 40 minutes at the longest today. So if you do have questions, and probably for a lot of you, there will be questions that will come up as I'm discussing each of the different diets. So again, you can feel free to use the comment section to ask questions as the talk progresses, but if you have more in-depth questions, definitely just call our office to arrange a 15-minute phone consultation, because probably a lot of you will have a lot of questions and we won't have time to get into a lot of detail with each of these different diets. So again, this is really just meant to be an overview and an introduction to briefly touch on each of these diets, and more personalized help is available through that phone consult. So, okay, so let's get started. And again, just a reminder to feel free to use the comment section to ask questions or make any comments as the talk progresses. So as I mentioned, today I'm going to explain several different special diets that I commonly use for autism as well as ADHD. ADHD standing for Attention Deficit Hyperactivity Disorder. Again, remembering that the classification ADHD is used as an umbrella term for all types of ADHD. So even if a child doesn't have a hyperactivity component, the American Psychological Association changed the naming of it. And so there's ADHD that is primarily a hyperactive type, primarily an inattentive type, where the child doesn't have much hyperactivity but just has the difficulty with focusing and paying attention, and then there's a mixed type. So when I say ADHD, just know that that term applies to children even if they don't have hyperactivity, but it can also apply just if your child has difficulty with focus and attention, particularly with schoolwork. So I'm going to talk again about each of these different diets and explain some of the symptoms that can be helped by each of these diets. So there are a number of special diets that can be helpful for autism or ADHD, and these are some of the ones that I'm going to be touching on. So the gluten-free and casein-free diet, the Feingold Diet, the gut and psychology syndrome, or sometimes known as GAPS diet, GAPS, the Specific Carbohydrate Diet, the Low Oxalate Diet, and we'll talk a little bit about some other things too. So besides those specific diets, there are many children with autism or ADHD who have food sensitivities or allergies. And there's often significant improvement in symptoms once those problem foods are eliminated. I also want to emphasize that the right diet can make a difference in more than just digestive symptoms. So particularly in autism, there often tend to be digestive symptoms or problems. For example, diarrhea, constipation, tummy pain, acid reflux. And so many children with autism have digestive symptoms. And definitely the diets can be very helpful for digestive symptoms and very often resolve a lot of those conditions. But I do, again, want to emphasize that these diets will be helpful for much more than just digestive symptoms. Most children with ADHD usually do not have digestive symptoms. So even if your child doesn't have any clear digestive symptoms, know that these diets can also be very helpful for them. So I've seen a number of children who have no digestive issues and have seen other symptoms improve with dietary changes, and sometimes very dramatically. So these can include problem behaviors like aggression, hyperactivity, particularly in autism, self-injurious behaviors where children are banging their heads on the wall or hitting their face, or where they're biting themselves, other kinds of things like that where they're harming themselves. And also stimming. So children with autism often engage in stimming, in a behavior known as stimming, and that can include many types of different behaviors. So that might include some children jump up and down and flap their hands. There are other children who will spin in circles over and over again. There are some children who will get a string, or they have a favorite toy or a sensory toy, and they might always be moving it back and forth or looking at it out of the corner of their eyes. There are some children who may redo certain behaviors over and over and over again. So these are all considered to be stimming behaviors. And so I've seen some of the stimming often be helped by dietary changes. And then also especially for ADHD with focus and attention, also hyperactivity and oppositional and defiant behavior is sometimes even helped by diets, and also language and overall cognitive function. So the question is, how could changing your diet affect these types of symptoms? So one of the answers is that there's a really big overlap between the gut and the brain. And some of the reason for that is that there are a lot of neurotransmitters or brain chemicals that are actually made in the gut. For example, there's a brain chemical called serotonin. And serotonin is very important for helping to regulate mood and a number of other types of things. But most of the serotonin is actually made in our gut. And there are other neurotransmitters or brain chemicals like norepinephrine and dopamine that are also affected by the gut. So if there is inflammation in the gut, or if there are other problems in the gut, then that can actually affect brain chemicals, these neurotransmitters that can affect focus and language, attention, mood, all of these things. And so that's one of the answers in terms of why food can affect all these other types of behaviors. Another answer is that there are certain foods, especially if people have allergies or sensitivities to certain foods, that certain foods can actually increase inflammation in the body. And it is known that if there is more inflammation in the gut, our body will make more of certain types of things called chemokines or cytokines. These are basically chemical messages that are sent that cells use to communicate with each other. It's basically how cells talk to each other. They exchange these chemical messages. And there are certain types of these chemical messages where if you have a lot of inflammation in the gut, that triggers the body to make more of these chemical messages that say inflammation, inflammation. And if there are high levels of inflammation in the gut, some of those cytokines, those chemical messages, can actually cross the blood-brain barrier. They can get into the brain and actually trigger inflammation in the brain. So there are many research studies that actually do show evidence, particularly in autism, of inflammation in the brain. where there are in some cases, actually antibodies or proteins made by the immune system that may actually be attacking the brain. So there is very well documented evidence that, particularly in autism, there can be inflammation in the brain. There are some blood tests that I do that are markers for inflammation, and often I find that those markers for inflammation are also high in ADHD. And so that can be one reason why certain foods can also affect other things like behavior. So if there's more inflammation in the body and there's inflammation that's affecting brain function, then increasing some of those foods that create more inflammation can create more problem behaviors. Decreasing foods that create inflammation can help the problem. Another reason why changing diet can be helpful for affecting behavior or language or focus or attention is that, of course, we get a number of nutrients from our food. And so if a child is not getting enough of certain nutrients, then that can cause difficulty with focus or attention. That can cause difficulty with other kinds of behaviors. So, for example, zinc is a nutrient, it's a mineral that's really important for focus and attention. And very often, so I see a lot of children with ADHD, and very often when I check their zinc levels, I find that their zinc levels often are below optimal. And so giving foods that have higher amounts of zinc can often be helpful. However, there are some children that I've seen where it's they have high levels of a nutrient, insufficient levels of a nutrient called copper. And copper and zinc are two minerals that are kind of like a seesaw, so they balance each other out. And so if you have too much zinc, then the copper can be insufficient, or the other way around. If you have too much copper, then you may not have enough zinc. So it's helpful to actually test these levels to see if a child is deficient in certain nutrients. And you don't want to just go out and eat a whole bunch of high zinc foods or give high zinc supplements, because you may have a child who's actually deficient in copper. And if you give more zinc, that could actually drive their copper levels down. So that's where testing is important, to really individualize and see, what does your child need? Another thing that's important is vitamin D. So vitamin D is actually very important to help regulate mood. And so although most of the vitamin D comes from sun exposure, there are, of course, certain foods that are high in vitamin D as well. So some of those foods being things like mushrooms, dairy products that are fortified with vitamin D, and there are a number of other foods that are high in vitamin D as well. So again, there's a number of nutrients that are really important. One thing that I found is that many children with autism tend to be extremely picky, and so getting healthy foods into them is a huge challenge for their parents. Even if the whole family eats really healthy, I've seen cases where the whole family eats really healthy, and then the one child with autism is like the only thing they'll eat is bacon, and then that's it. Like they won't eat any other foods. So I've seen cases like that, where a child with autism might be extremely picky, and as a result, they have nutrient deficiencies, and so they don't have the nutrients that they need to help their body to grow and to be able to focus and pay attention. And nutrient deficiencies can also cause a lot of the symptoms. So, for example, if a child is deficient in zinc, then that may decrease their sense of smell, and they may have difficulty being able to smell appropriately. And if any of you have had colds or things where you didn't really have a sense of smell, oftentimes we find that the foods don't taste so good, because smell is actually a really important part of the eating experience. So if you can't smell your foods well, then often foods won't taste that good. And that could actually be one potential underlying cause for picky eating, especially in autism, where if there's not enough zinc, then children could actually become more picky. And then it just becomes a vicious cycle, because they become more picky, so they become more deficient in zinc, and then they get even more picky. So sometimes we need to give supplements to kind of get them out of that downward spiral, and doing other kinds of things to help with that. Also, magnesium is really important for helping to regulate, especially something called sound sensitivity. So there are many children with autism who are extremely sensitive to sounds, where they will, if there's a loud sound like a vacuum cleaner, they'll scream, they'll cover their ears, the sound of a vacuum cleaner or the hand dryer in the bathroom in a public restroom can send them into a total meltdown where they're just screaming, they're covering their ears, they're just totally freaking out because the sound is just like totally overwhelming and really scary to them. Or the sound of a helicopter or an airplane or a fire truck going by could really, really bother them or send them into a meltdown stage. So those are some things. And if there's a magnesium deficiency, then that can actually cause sound sensitivity issues or these sensory issues with sound that could cause or actually make it worse. So these are just some of the ways that certain nutrient deficiencies can actually cause some of these symptoms. So what we want to do is we want to try to figure out what are the issues for your child in particular, and then individualize things. And I really wish that there was a one-size-fits-all diet that I could just say, okay, all kids with autism eat this way, follow this diet, and then you'll be magically cured. Or all kids with ADHD, follow this diet. I really wish that was the case. It would make things so much simpler, but unfortunately that just hasn't been my clinical experience. And what I found clinically is that every child tends to be very different. And foods that are great for one child may be a disaster for another child. And so again, that's really where individualizing the foods really become very important. And doing testing to figure out, okay, are there nutrient deficiencies? Are there certain imbalances? Are there food allergies or food sensitivities that we really need to work on with getting those particular foods out of the diet? So those are some of the things that we discuss when I see patients. So some of the basics. So before I get into the individual diets, I want to talk about just some basic guidelines that I think apply to pretty much everyone, regardless of if it's a child who doesn't have autism or ADHD, or a child who does, or just all adults, in general. I'm going to just talk about some basic food guidelines that I think are important in the foundation for healthy diets, and then we'll get into some of the more specific type of diets. So as a foundation, the general thing that I recommend for people is, of course, just trying to avoid junk foods. So particularly soda is extremely high in sugar. Even the 0-calorie ones, they do have artificial sweeteners. And there's of course different opinions on artificial sweeteners. But I found that especially many children with autism and ADHD tend to be sensitive to things that are artificial. So artificial dyes, artificial flavors, artificial sweeteners. Because these things are artificial, our body doesn't recognize them. And often they can become problems for certain people. So, and I mean, dyes and artificial flavors and artificial sweeteners, they're not healthy for anyone really. And there are studies finding that for some children, consuming higher amounts of artificial dyes or artificial flavors or artificial sweeteners is correlated with a higher incidence of ADHD or difficulty with focus and attention. So it is something that I recommend that pretty much everyone really try to avoid. And it's interesting because in Europe has banned a lot of these dyes and artificial flavors and artificial sweeteners. And the whole way that ADHD is approached in Europe is very different than America. But I think banning a lot of these dyes and artificial flavors are just generally helpful. So these additives are of course not banned in the United States, but avoiding them is helpful. And then also just trying to avoid a lot of processed foods or more sugary foods. Again, it doesn't mean that you can't ever have, enjoy some treats or a chocolate or things like that, but it shouldn't be, sugary foods like cookies, cakes, pies, processed foods like French fries and hamburgers and everything, it shouldn't be the mainstay of anyone's diet, really. I mean, I think that for most people, having a little bit of some of these things once in a while, special occasions, holidays, birthdays, that's fine, but it really shouldn't be your diet every day or the bulk of your diet, because it's just not a healthy way to eat. If we look at all of these countries, traditional cultures where people have, they tend to be very healthy, they have very low incidence of cancer, dementia, autoimmune disease, low incidence of autism and ADHD. It's all of these traditional cultures that eat basically the way that people ate 100 years ago, eating traditional diets, not having all this westernized processed junk food, because this is really something that has come about primarily in the last 100 years. But before that, we really didn't have a lot of these processed foods. And just trying to eat more vegetables in general, those are things that are helpful for pretty much everyone. Now, if you have a child with autism, you may be listening to this and say, okay, well, that sounds all great and all, but I have a child that literally will only eat French fries from McDonald's and will only eat cheeseburgers and will only eat grilled cheese sandwiches, and that's all my child will eat. And so I would say the two most picky cases that I've ever had, I had one child who would literally eat, I had a child who would literally eat one food, and it was the chicharrones, it was deep fried pork rinds, the chips, and that was literally the only food that he would eat. And his cholesterol was like sky high, it was through the roof. And then I had another child who would literally both of them had autism. I had another child who literally would only eat bacon, and that was it, like fried bacon, nothing else. So, I mean, it's a process, but, I was with both of those cases, we're able to work with a child and slowly, eventually be able to expand their diet. So I'm just going to touch on some tips for picky eating. And then, I see a question over here. Do you feel that stevia and erythritol is okay? So, stevia is a natural, stevia is originally derived from a leaf, which tastes sweet but doesn't contain any sugar. For most people, stevia is usually fine. If possible, the least processed form of stevia is actually green stevia powder, which you can get online. I've seen it on Amazon. It has kind of a green tea flavor, but if your child will eat that, that's great. There are other forms of stevia, of course, liquid and white powder forms. So I do think that stevia is okay for most people. In general, I think the alcohol sugars are usually a better choice for most people than the artificial sweeteners, erythritol or xylitol. That being said, erythritol and xylitol are not allowed on the Feingold diet, and there are some individuals who do have issues with erythritol or xylitol, and so for some individuals, they have difficulty with those. So that again really depends on the person. So just some tips for picky eating if you do have a child who's an extremely picky eater, especially with autism. So some of the things that I found, like I mentioned, is that some of these issues can be due to problems with nutrient deficiencies. And so, and sometimes there could also be other issues like gut inflammation. There may be inflammation along the esophagus, where some children are really picky. And if there is inflammation in the gut, or if your child is particularly craving sweets all the time, there may be an overgrowth of yeast in the gut. Because yeast is fed by sugar. And so particularly, this is the case not only for autism, but for adults as well, or other people who don't have autism. that if you're craving sugar all the time, constantly, it may be an issue with yeast overgrowth. And so that's something that needs to be addressed. So often I'll test for that and see if there's imbalances in the gut that we can address with using herbs or other kinds of medicines to help address yeast overgrowth, or helping to reduce inflammation. And then that may help with picky eating. Another thing is that there are children who have sensory issues where the sights or the smells or the textures of certain flavors can really, really bother them. So if you, just to give you an idea, like if someone handed you a plate of worms and said, here, eat these, they're super yummy, you know, I mean, most of us would be really repulsed by that, you know, because the texture is just, you know, the texture is different than most people are used to, and just the thought of that. And for many children on the autism spectrum, that can be the experience of what it's like to eat certain foods, that it's just really, really repulsive, and it's the texture. They have a problem with certain textures. Like I have some children with autism who will only eat crunchy foods, who will only eat, or who will never eat slimy foods, or foods that have a softer, mushy kind of texture. Like they'll never eat oatmeal, or they'll never eat pureed foods or things like that. So addressing that with a behavioral therapist or an occupational therapist can be very, very helpful. There's certain feeding therapy programs that can be very, very helpful for children with autism who are extremely picky. So some of the specific programs I've seen be very helpful. So Sprouts Therapy is an occupational therapy clinic, and they have a feeding therapy program that specifically addresses a lot of the sensory issues that children have, where they're really repulsed by certain textures or the feel of foods or things like that. And they work with them step by step to help address those, to help overcome picky eating. So I've seen that program be very, very helpful. Also, a lot of ABA clinics have feeding programs that can be very helpful. So behavior analysis, Noka-Oi or Banco specifically, they have a feeding therapy program that I've seen be very helpful for some children who are extremely picky. So working with a well-trained behavioral therapist or occupational therapist can be very helpful, especially if children have sensory issues where they seem to be very repulsed by certain smells or textures or other kinds of things. And something that you can do is just working with them to play with their food and help introduce them to new foods. So for example, you might have them, you know, get different kinds of foods and then actually like touch them or play with them, or you might put some foods into like a food processor or something like that, or they can get plastic knives where they can cut the foods and play with them. And just touching the foods is helpful for a lot of kids, just to kind of get used to the texture, and then you can work on getting them to, if they just touch it to their mouth, and that's a success, and you reward that for them. And then the final step would be actually putting into their mouth, and if they spit it out, that's okay, but they actually put it into their mouth. And then the last step would actually be eating the food, putting it in their mouth and chewing it. So a lot of these these feeding therapy programs work on that, but that's something that you can do with your child as well. Just keep introducing new foods, allow them to play with their foods, make it fun. If they like crunchy foods, and try to make healthier foods that are crunchy, like sweet potato chips or kale chips or things like that, where it fits the texture that they really like, and start to try to introduce new foods. Another thing that can be helpful for picky eating is just trying to avoid allowing your child to snack constantly. So, so a lot of times, a lot of our children will just graze, where they're just snacking constantly. But if you actually just try to limit them to, 3 main meals, and actually allowing them to get hungry for their dinner time, then there will be some children who will be more accepting of foods because they're actually hungry, at dinner time, rather than, oh, they've been snacking all day, so they're not really full, and then they're going to be more averse to trying new foods. Something that can also be helpful is letting them try, one food. So if there's a food that they really like, you could try the technique of allowing them to have just, just try just one bite or just touch this new food to your mouth. Okay, and then you can get the food that you really like as a reward. Or just take one bite of this new food, and then you can spit it out, and then, give them the food that they like. So that can be a helpful technique for some kids. And then, like I said, also addressing nutrient deficiencies. And there are some children who are extremely picky because they're actually addicted to certain foods. So I'm going to transition now into talking about the gluten-free and casein-free diet. So gluten is a protein that's in wheat, rye, barley, and in oats that are not gluten-free. I'll explain that a little bit. In that oats are often grown together with wheat, and so often they are contaminated with gluten. But you can get specific gluten-free oats. Casein is a protein that's in dairy. So dairy meaning cow's milk products. So cow's milk, cheese, butter, ice cream, yogurt, products that are made from cow's milk. And then also products that have milk in them, like baked goods or mac and cheese, or sometimes there may be cookies or other kinds of things that have milk in them, that have milk baked into them. Or they might have cheese in them, like Cheetos, for example. So gluten and dairy. So the gluten-free, casein-free diet is often a good diet to start with as a baseline for many individuals with autism. It can be helpful for some individuals with ADHD as well. So there are tests that we can do to check for sensitivities or allergies to gluten or dairy, but just know that even if a child doesn't have an allergy or sensitivity, there could be other ways that gluten or dairy could be problems. One of those ways is that there's an enzyme called DPP4. DPP4 is the enzyme that helps to break down gluten and dairy. And there are specific pieces of protein, these components within gluten and dairy. So in gluten, there's something called gliadorphin. And within casein, or the milk protein, there's something called caseomorphin. So these molecules are peptides or pieces of protein that they're structurally similar to opiate molecules. So most people have the enzyme DPP4 to break them down, but there are many children, particularly with autism, who don't make this enzyme, or they don't make enough of it. And then as a result, they have trouble being able to break down the gliadorphin and the caseomorphin. So what happens is when they don't have the enzyme to break them down, the gliadorphin and the caseomorphin actually stay intact, and they can actually bind to opiate receptors in the brain and cause opiate-like effects. And if you think about someone who is on opiates, so for example, that would be like Vicodin, morphine, heroin. So opiates, what they do is they slow things down in the body. They slow down the brain. They slow down the processing of the brain. And so people who are on opiates, oftentimes they'll be just kind of cognitively out of it, not very aware. They will often have a much slower response time, just not able to process things as quickly. And that's often the case with many children with autism, that if they don't have this enzyme to break down the gluten and dairy, then they can actually have a slower cognitive response time and slower processing time. And so that's why I say this may be the case in some individuals with ADHD as well. And so there is a test available to check to see if you make the DPP4 enzyme or if you make sufficient amounts of it. So again, you can't just test for allergies to gluten and dairy. You need to do other tests, or people can also, they can always do a trial of taking gluten and dairy out of the diet and then see if your child seems to improve with that. If you do a trial of a gluten and dairy-free diet, I tell people they really need to do a minimum of at least 3 months. Ideally 6 months is better. There are also some individuals who have issues with soy, so sometimes you also need to take out soy as well. But really at a minimum, you really need to take out those foods for at least 3 to 6 months. And then you can reintroduce it afterwards and see if you see any differences. The reason being that for the gliadorphin and casomorphin peptides, it takes at least 6 to 8 weeks from the time you stop eating them for them to completely get out of the body. So as a result, if you just do a gluten and dairy-free diet for a week or a month or even 2 months, you may not get to the point that you've really seen the full benefit from it. And you really need to do a longer trial of the diet and then reintroduce it. So again, this is a good foundational diet. The reason that I bring this up in the context of picky eating is that there are some children, if you also think about other effects of opiates, another effect of an opiate molecule is that it has addictive properties, as we've unfortunately clearly seen from the opioid crisis in the United States, that there are substances that are very addictive. And so I've seen some children with autism who are literally it's like they're addicted to gluten and dairy, and that's all they want to eat. Like I have families that come in, and if we talk about the gluten or dairy-free diet, they're like, oh my gosh, you're kidding me. That's like all my child will eat. My child will only eat mac and cheese. My child will only eat grilled cheese sandwiches. My child will only eat ice cream. They will not eat anything else. If I take that out of their diet, they're going to starve because they're not going to eat anything else. But I've seen a number of these children who are really addicted to these foods, that as we take the foods out, it tends to be very difficult in the beginning because it's like a drug addict coming off of an addiction. I've seen kids who have climbed all the way up to the very top shelf, the cabinet, to get at, like a box of, or a thing of bread, or get the mac and cheese or something like that. I've had families that have had to put locks on their fridges. But once you get the gluten and dairy out of their system, then I've definitely seen children where as those foods get out of their system, then their diet actually starts to open up. And because when they're on it, if they are addicted to it and they're not making enough of that enzyme to break it down, it's like an addict. That's all they want. But once you're able to get it out of their system and they're not so addicted to just those foods, then you're able to start, some of these children will start opening up and will start eating more foods. So again, that's just a brief overview. I'm going to move on to the Feingold Diet. So the Feingold Diet, it's spelled Feingold, and it's named after Dr. Feingold, who first started or pioneered the Feingold Diet. And with the Feingold Diet, this is something that's applicable very often to ADHD and in some cases, to autism as well. So the Feingold Diet, it basically takes out foods that are high in phenols and salicylates. So salicylates are compounds that are naturally occurring in foods that plants will make to protect themselves from bugs and pests. So there are certain foods that are naturally high in salicylates and phenols, and there are some foods that are not. There are artificial salicylates and phenols. So some of these include, as I mentioned earlier, artificial colors. So artificial phenols are things like artificial colors, artificial flavors. There are certain preservatives. There's also a preservative called propionic acid, which is an artificial phenol, and that can cause problems. So as I mentioned, things like artificial colors and flavors and all the preservatives are not healthy for anyone. So I usually recommend trying as much as possible to try to avoid those things. But there are a number of foods that we usually think of as healthy foods, which are high in salicylates and phenols, and that can be problems for some individuals with autism and ADHD. So some of the signs to look for in terms of sensitivity to phenols or salicylates, so common symptoms that we see in children who are sensitive to phenols and salicylates: hyperactivity, problems with sleeping, aggression, irritability, diarrhea, headache, head banging or self-injurious behavior, kind of crazy or inappropriate laughter. I've had parents with autism who say, my child wakes up in the middle of the night and they're just like in their bed and they're just laughing like a lunatic at like nothing, and they're just like, I have no idea what, my child was awake for a whole hour just laughing and laughing in their bed at like nothing. Or I've seen some children who have crying where they just kind of cry out of nowhere and parents can't figure out why they're crying. That may also be another sign. There are some children who will have hives or rashes, and then also some children who have red cheeks and ears. And there are some types of seizures that may be a sign of a phenol or salicylate sensitivity. So if your child doesn't have your child doesn't have to have all of these things, but if your child has some of these things, then that is an indication that you may want to do a trial on the Feingold Diet. So if you just look up the Feingold Diet, Feingold, you'll find a lot of information about it. But some examples of some foods that are high in phenols and salicylates, some of the most common problem foods I find are grapes, especially red grapes, apples, berries, citrus, cucumbers, peppers, like bell peppers or chili peppers. So there's a whole list of other foods. But what I usually have families do is I usually have them follow the Feingold diet for at least 3 weeks, sometimes longer. And then what you can do is after that, you can reintroduce all of these foods in large amounts at every meal. And then see if you see any differences. Because if a child does have a phenol or salicylate sensitivity, then you will definitely see a difference in behavior, in hyperactivity, and sleep, and all these symptoms after you've taken it out of the diet and then you reintroduce the foods back in. And again, this is not meant to be an exhaustive review, but just to kind of quickly go over them. There's a couple of other diets, the gut and psychology syndrome diet and the specific carbohydrate diet. So these are diets that are helpful, particularly if there seems to be a lot of gut issues or a lot of digestive problems. So particularly if a child has a lot of alternating diarrhea and constipation, or one or the other, a lot of constipation or a lot of diarrhea that's just not being resolved by doing the gluten and dairy-free diet, or by taking out food sensitivities or food allergies. If you've already done these things, like if you've taken gluten and dairy out of your child's diet and you've tested the child for allergies and sensitivities, you've taken those foods out of the diet, the child's still having a lot of gut inflammation or diarrhea or constipation, then this is a good thing to look for in terms of doing either like a specific carbohydrate diet or the GAPS diet. So the premise of the specific carbohydrate diet and the GAPS diet, these two diets are pretty similar to each other. There are some slight differences, but the basis of them is primarily the same in that you're removing more complex sugars and you're allowing only monosaccharides or simple sugars into the diet. And so that will allow honey, fruit, certain non-starchy vegetables, but it's basically taking out most sugars and starches from the diet. It's mostly grain-free and takes out definitely all the refined sugars, so sugary foods and things like that. So, and particularly for children who seem to have a lot of gut pain or inflammation in their bowels, or children who have chronic yeast issues that's just not getting resolved, the specific carbohydrate diet and the GAPS diet are good things to look at. Some of the differences between the specific carbohydrate and the GAPS diet, so the specific carbohydrate doesn't take out dairy specifically, and then the GAPS diet, it allows for, it initially takes out dairy,
but then it later allows for the reintroduction of dairy. And there are some other differences. But again, I'm not going to go into an exhaustive overview of these diets. If you just look up Specific Carbohydrate Diet or the GAPS diet, Gut and Psychology Syndrome diet, you'll find a lot of information on there. But that's just an overview. So a lot of gut issues are some of the main issues that I look for. That can be a good indication for specific carbohydrate or for GAPS diet. And another diet that I wanted to touch on is the low oxalate diet. And so low oxalate, that's a diet where there are certain foods that are high in something called oxalates. And this is a diet that is particularly helpful if there seems to be a lot of pain in the body. So particularly if a child seems to cry all the time. A lot of our children with autism are not able to tell us, my head hurts, my tummy hurts, my back hurts, or other kinds of things, my joints hurt. But you can look for signs and symptoms. So one is that if the child just cries randomly for no clear reason. And another thing is that if there is a lot of aggression or self-injurious behavior, many of these children are aggressive or self-injurious because they have some kind of chronic pain that's going on. And so that can be a sign, actually. So I'll often look at the low oxalate diet or discuss that to see if that could be an issue in some of these children. So the main symptoms are pain. If there's a lot of inflammation in the body that just isn't going down with other interventions. This is not as frequent, but this can happen more in adults, not as much in children, but kidney stones is one thing to look for. Because the most common type of kidney stone is called a calcium oxalate stone. And so if people have difficulty breaking down oxalates, then that's something that can be an issue. Other things to look for, if there seems to be any kind of autoimmune conditions like fibromyalgia, where there just seems to be a lot of pain all the time, or really persistent yeast issues, or other problems in the gut that just aren't resolving with other diets and other interventions. The low oxalate diet is one to look at. And so some foods that are high in oxalates are often foods that we think of as very healthy. So spinach, a lot of the greens like kale are high in oxalates, beets, almonds, peanuts. Most nuts are high in oxalates, cashews, soy. There are some beans that are high in oxalates as well. So this can be an issue for some people. I would say it's certainly not as common as children who respond to a gluten-free and dairy-free diet, but oxalates are a common one that can happen. And so these are just some things that we look for. And again, this is just meant to to just be a brief overview. And if you have more questions, again, there's probably lots more questions that we could get into. And the final thing that I wanted to touch on was food allergy and sensitivity testing. So most of the families, a lot of people have heard about allergies. So, they go to their regular pediatrician or their doctor and say, hey, can you test me for allergies? So that's a test where we look for something called IgE that the body makes. IgE is a certain type of protein. And if you have allergies, then it will show up as high. Certain foods will show up as high. But there's also an issue for some individuals with food sensitivities where it's a different antibody called IgG. And people need to understand that these are two completely separate antibodies, two completely different proteins in the body. And so someone may have a food allergy test, and then dairy doesn't show up on there. But then they could do a food sensitivity test for IgG and find that dairy does show up on there, because again, they're two completely different types of antibodies or proteins. So just, it's important to realize that it's really not sufficient to just get a food allergy test. I mean, that's a helpful first step. But I have a lot of families that come to me and say, you know, I took my child to our pediatrician, they tested my child for allergies, there's no allergies, so, you know, we don't need to take out dairy, or we don't need to avoid gluten, we've already ruled that out. But, you know, I tell people, well, there's a lot of other ways that a person can actually have problems with certain foods. So the allergies are a good first step, checking for those, but we often need to check for sensitivities. But people may have problems with certain foods because they also don't have the enzyme to break it down. So what I talked about with DPP4 earlier, the enzyme to break down gliadorphin and casomorphin, or basically those parts in gluten and dairy, that may be an issue. And there can be other issues with some of these other foods that I talked about. So just know that diet can't just be determined by just a food allergy test. Often there needs to be much more extensive testing and a careful history to really figure out what could be going on. So again, this was not meant to be an exhaustive, you know, review of all the different diets, but just to provide a brief introduction to touch on each of these things. So again, I will be wrapping up, but I want to thank you again for being here. I appreciate the opportunity to let you know about the natural medicine approach and the different dietary approaches to treating autism and ADHD. So if you would like to talk with me about more questions that you have about any of these different diets or what may be indicated for your child, it's really easy. Just call our office and ask to schedule a personal health strategy session, a free 15-minute phone consult. And that's for people who are interested in going deeper and then finding out more indications to individualize things for you or for your child. Just call our office at 808-425-2987, and you'll also find the contact information on our Facebook page. So mahalo for being here. Feel free to share the video with any friends or family that you think could benefit, because there's a lot of very important information this lecture today. And so we'll see you back here in about 2 weeks. Okay, aloha.